This is Dr. Girish Nelivigi, urologist and andrologist from Nelivigi Urology and Multi-Speciality Hospital in Bangalore. Welcome to my channel, Urology for Everyone. I have been dealing with various topics in urology for some time in the form of videos and podcasts and also blogs. And we have covered most of the topics in urology, including urinary bladder. However, since November is Bladder Awareness Month, I'll give a short overview and also discuss on how to deal with some common bladder problems and how to take care of the bladder. In this video, I'll be talking on a very common topic which is faced by men as well as women, especially women, that is infections of the bladder. Infections of the bladder in medical parlance are called cystitis. Most of the time, or almost always, they are bacterial infections. Infections of the bladder occur very commonly in women and less commonly in men. When they occur in men, they usually have some causes, like for example, elderly men with prostate enlargement and blockage to the passage of urine do get bladder infections. Whereas in women, bladder cancer infections are common, and most of them we call them primary, that is without any specific cause. There are rare situations of bladder infection for women where there is a cause, surgical cause, which can be treated, but most of the time they are gender related, which means they get bladder infections because women are prone to bladder infections. What are the symptoms of bladder infections? One is burning sensation while passing urine, increased urinary frequency, urgency to pass urine. Sometimes there could be a leakage of urine, that is, before you reach the toilet there is a leak of urine, and many people get up multiple times in the night to pass urine. Sometimes there could be pain in the lower abdomen and also in the umbilical region and also in the groins. So these are the common symptoms of infections of the bladder. Rarely there could be fever, but it's not that common. When you go to a doctor, he or she will prescribe you some tests, and the most important test is an urine examination. A urine routine examination will tell you if there is infection of the bladder, and if there is infection of the bladder, the treatment is usually by antibiotics. In very mild infection of the bladder, drinking a lot of water and doing some dietary restrictions may help. However, when the infection is more, only antibiotics help. So the doctor will prescribe urine examination, confirm if there is infection and treat you. Sometimes when there is some confusion, or when he feels that there is more to it than just infections, or when he wants to find the cause for infection, he may order additional investigations like ultrasound. So the treatment for bladder infection, as I already told, is by antibiotics. This is given as a course of 3 or 5 days depending on the severity, and also some supporting medication to decrease the frequency of urination is given. Some drugs which decrease the burning sensation in the form of alkalinizing solutions are also given. This is about the general treatment of infections of the bladder. In a male, especially in elderly male, as I told you, prostate enlargement is a frequent cause for bladder infection. And apart from treating bladder infection, in such individuals, we have to treat the blockage because of prostate also. So this is in general how a bladder infection is treated. Thank you for watching this video. I'll be back with another one next time.